Hi everyone, welcome back to XGate Dental. I'm Emmanuel Kadosh and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases, so don't forget to subscribe and follow to stay up to date. Today we'll be talking about important things to know about teeth development in children. First of all, you need to go to your dentist with your kid on his first tooth because the dentist can inform you and can explain to you about toothbrushing in children. The doctor will explain to you how you need to properly take care of your child's teeth to make sure that they're brushing their teeth with toothpaste or without, with the kind of toothpaste that they need, and with what concentration of it, if your kid has high or low risk. Everything can be seen. What about when your child's teeth are falling? Do we let them fall out on their own? Well, when the permanent tooth is erupting, not in the proper place, it's possible that the tooth won't fall right away. So you need to help it, like extracting the tooth, but it's not the most important thing. The most important thing is how you properly take care of the tooth. And you need to, for the kid to get used to seeing a dentist, because in many cases in the older ages, when a kid or a grown-up has a phobia of a dentist, it's because he never saw a dentist, because he never saw or had any interaction with a dentist at the younger age, and then he was afraid and doesn't want to do treatments. And sometimes it's inevitable that you need to go to the dentist. You might have some issues that you need to take care of. Kids need to get used to the idea that someone will be checking up on their teeth and that the doctor is making sure everything is good. Then the parents also need to have some guidance in the process, because you don't always know what's best and about what kind of foods, when to brush, and all of that. Now, if you know that your kid has orthodontic problems, then don't only go to the dentist when he's 15. You need to go to the dentist or to the orthodontist at around 6 to 8 years old to see when the youngest age is when we can start some kind of treatment. In the growth spurt, when the kid is growing, it's much easier to treat some kind of problems. You can use all those stages in the growing part of the kid to your favor to help to make the treatment as easy and as good as possible. First of all, start brushing your child's teeth even before they have any teeth, because you need for them to get used to the fact that someone is touching their gums and someone is opening their mouth. Later on, when they'll have some kind of teeth, it'll be much easier. Then you brush your kid's teeth at least twice a day. In the evening after brushing his teeth, you don't give him anything except for water. Most of the cases when you have caries in younger children, it's because of the improper diet. You've given him things to eat and then you put him to sleep with a syrupy water or 7-Up. Sugar for teeth is terrible, and when you sleep and you give him some kind of sugar, it's the worst thing that you can do, because the saliva doesn't clean the teeth and the sugar stays there. And the first teeth that the kids have are much more susceptible to caries. They're much easier to be infected. If you extract primary teeth before their time, you can have problems later on with orthodontics. Everything has its own time. You can't just extract them all, because later on he'll have some sort of issues. You'll have wrongly erupted teeth at the wrong time, and it's very difficult to correct that in older ages and with a lot of problems with orthodontics and in many cases. Now, what about premature teeth? Well, in spite of your body, the fact that it falls doesn't mean anything, because if the process is done incorrectly, you'll have a lot of problems, mostly with orthodontics in later ages. So in many cases, even when you extract the tooth before it's time, we need to reserve this place. We have different kinds of treatments for the teeth not to move or to hold places for permanent teeth. It's something that you always need to think about. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more, and of course, don't forget to subscribe, like, and follow. Thank you, and see you next time.